Welcome to Radio CAHS, presented by CAHS Chief Executive Dr Arish Anwar.
Welcome to Radio CAHS.
Good afternoon. You may notice I'm not Arish, I'm Valerie, but I'd like to start and welcome to country. I want to acknowledge the traditional custodians of the land, the Noongar Whadjuk people, and the Aboriginal people of the many traditional lands and language groups of Western Australia. I want to pay my respect to the elders past, present, future and emerging. So welcome to Radio CAHS, Friday afternoon. And welcome to today's show. It's a special edition hosted by me. Now, if you've got a pen and paper, it's Valerie. I think you just need to keep that in mind for the WA Annual Radio Host Awards. So, Valerie Jovanovic is my name. I'm the Executive Director, People, Culture and Capability. And today's topic is on staff health and wellbeing at CAHS. Now, I need to ask a favour. If you see Arish, if you do see him this afternoon, please distract him. Because if he finds out that someone has given me access to a microphone, he'll be up here in a shot. So let's just keep going with it. Now, can you believe that it's spring next week? Unbelievable. But how wonderful is that? So I thought today, just to change things up a little bit, I'd incorporate a spring theme. However, I think you're going to have to excuse me during today's show because my fear of magpies will be evident. Why are we talking about magpies? It's swooping season. But they do say that you should talk about your fears, so I'll be doing that today, so just bear with me. But before I move on, did you know that the common magpie is one of the most intelligent birds and one of the most intelligent animals to exist? Magpies have shown the ability to make us use tools, imitate human speech, grieve, play games and work in teams. Fascinating. Today, we've got a fantastic lineup. We're going to be talking to Dr Chris Blyth, Head of Infectious Diseases at PCH, who is back from his secondment at the Department of Health, and Evelyn Kennedy, our Health and Wellness Coordinator at CAHS, who's been here for a few weeks now, so it's lovely to speak to her this afternoon. You can call in on 6456 5629 or text on 0436 595 600 to ask a question about COVID or any of the topics that we'll be covering a little later in the show. I'll start off with the audience quiz. Now, there was an audience quiz during the last week's session, so I'll just repeat that one. A cyclist with COVID-19 leaves Venice at 2:35 p.m. and travels at 10 kilometres an hour. A second cyclist leaves along the same route at 2:45 p.m, travelling at 16 kilometres per hour. How far do they travel until the first cyclist is at risk of infecting the second one? Now, this question was a doozy. The answer is there a drum roll? No. Yeah. Oh, no. No drum roll. 5.8 kilometres. Now, I didn't have the correct answer. We actually didn't get a correct answer. So we've chosen the closest. So we like to congratulate Valerie. Astrid. Astrid has chosen the... so congratulations, Astrid. Well done. Astrid has chosen the Indigenous Literacy Foundation as the charity she would like to donate to. So congratulations and well done. Are you ready for this week's audience?
Call now on 64...
Sorry. All right, so my radio career has just been cut short. So the next question, this week's question. A pond has one lily pad on it. Every day, the number of lily pads double on the pond until the pond is completely covered by lily pads, but with no overflow of lily pads. Are you ready for the question? What percentage of the pond is covered 3 days before the pond is entirely covered? Again, what percentage of the pond is covered 3 days before the pond is entirely covered? Getting quick, send your answers to us on 0436 595 600. Did you know that Australian magpies generally live to around 25 years of age, through to up to 30 years have been recorded? I could potentially have the same magpie swooping me for up to 30 years. The reported age of first breeding has varied according to area, but the average is between the ages of 3 and 5 years. Again, fascinating. Now, COVID update with Dr Chris Blyth. So welcome, great welcome to Chris. Chris has been on secondment to the Department of Health, where he's been the clinical lead for PPE across WA Health. But he's back with us again at PCH. It's so fantastic, Chris, to have you back.
Thank you.
Why don't you tell us a little bit about your experience with the Department of Health?
Oh, well, it's been an interesting role and one that's been pretty challenging. It is very difficult with the uncertainty that this has as far as what we're planning. But importantly, those plans have been really important to get in place to make sure that those WA Health staff, but importantly, everyone in the community is protected against COVID.
Now, fantastic! Look, great work, and there is still, a lot of planning to do, and I assume that we're keeping our eye on what's happening over east as well at the moment. But you did want to give us an update on the epidemiology of COVID.
I'm happy to do that. I thought it's worthwhile letting people know where we're up to, and clearly what you see in the routine news and the newspaper, we're in a very lucky position in Western Australia. All the cases we have in Western Australia have been detected in people who've come in from elsewhere, and importantly are all in hotel quarantine. We have not had a locally acquired case for a number of months in Western Australia, so we're in a very lucky position. I think the other reassuring things, although clearly vastly different than Western Australia, is some of the activity that really has been very worrying in Victoria is starting to slow down. A long way to go at this stage, but I think some of the concern that all of us had a number of weeks ago is starting to look a little bit better. But it highlights that we have an ongoing risk wherever you live in Australia at the moment, and we need to remain vigilant and prepared.
Absolutely, and yes, that remaining vigilance is so important, and it's really reassuring to hear for our friends over in Victoria that is in sight. We know, though, over in Victoria that the recent outbreak of COVID saw a high number of health workers contracting COVID. Can you tell us more about how this might be? And given that most of these people would be taking high infection control precautions like wearing PPE.
I think it's important when you look to the Victorian figures to try and break those down. So certainly the Victorian figures, as we saw in Western Australia in the early part of the pandemic, healthcare workers who were infected were largely infected from overseas travel and cruises in the same way that other people are. But importantly, in recent months in Victoria, in recent months in Victoria, a number of healthcare workers have been infected. Now, many of those have been infected in aged care as well as in the hospital space, and so the numbers you hear in the media, including those who work in residential aged care facilities as well as hospital. And the risks are important in both of those. Now, infection of healthcare workers can occur from a number of different ways, and importantly, the infections have occurred by those ways, from the community, from staff member to staff member, and most likely from patients to staff members. So reminding staff of all the really important things that they can do to try and protect themselves. You mentioned PPE, and clearly that's a very important thing, but importantly it's not the only thing that staff members need to think about at this stage. The simple things are really important. The staying home when you're unwell, if you're getting symptoms, getting tested, the hand hygiene, the making sure that we can adequately physically distance even in the workplace are critical steps that we all need to think about at the moment. Using PPE, using the right PPE using it and putting it on, taking it off in an appropriate fashion, and making sure that we're looking after our staff and helping those around us to do those jobs well are all going to be really important things to try and decrease and prevent healthcare worker infections. We're constantly looking at data about how we can improve our PPE recommendations, and we've made some recent tweaks to that. But I really want to stress to staff, as well as patients, actually, all those simple things are just as important to do as some of the more complicated, what do I choose in this situation?
Thank you. You've always got such great, valuable information for us and fantastic reminders, and particularly, I think, for us in WA, around that vigilance and not being complacent in relation to that as well. So some great tips, and particularly, when you're not feeling well, that it's okay to stay at home. Please stay at home.
In fact, we would really strongly recommend our staff do stay at home.
Yeah.
Don't take the risk. Don't take the risk for you. Don't take the risk for your colleagues. In fact, it's going to be more problematic you coming to work. Many people, particularly healthcare workers, soldier on, and this is not the time to soldier on.
Yeah. Do you have an update for us on possible vaccinations for COVID?
Sure, there's certainly been some interesting media in the last couple of weeks about vaccination, particularly with the federal government going into an early relationship with AstraZeneca, who's one of the mainstream vaccine manufacturers, who are really looking at bringing the Oxford vaccine to market. I think the other important thing is there are as many vaccine candidates out there. So there's really over 100 different candidates being explored, and many of those are actually in human trials at the moment. So actually injecting them into humans to make sure they are safe and they stimulate the immune system in the right way, and ultimately that they are effective. Many of these vaccines are in those later stages, but the challenge we've got, we don't know whether those vaccines will work yet. A lot of the data is really encouraging, and I'm encouraged that we will have a vaccine for this, but the timeline to those vaccines is challenging because it depends on whether they are proven to be effective in these studies. So if those early studies prove to be effective, we could have vaccines coming into Australia in the next couple of months. But clearly, if they're not, we're going to have to wait for the second and the third and the fourth cab off the rank. So a lot of work is occurring at the moment, working out who would be the most important people to vaccinate, how to vaccinate them, and which vaccines to vaccinate them with. And importantly then, how we make sure that we can keep the conversation going with the community about the importance of vaccination, who to do it, and how to monitor some of the safety aspects that we absolutely have to look to.
I know it was recently reported that there's evidence of patients recontracting COVID a few months after their initial infection. What effect will evidence of low antibodies have on possible vaccination?
Although there is some speculation that you can recontract COVID, we don't have good data on this. And it's more than likely most people will be protected after contracting it once or being vaccinated, that they'll have a degree of protection going forward. And importantly, it's actually that degree of protection that is really likely to stop the transmission in the community. And so we really need to understand this, but importantly, we need more time to understand this. We need to have people who have been infected who are being re-exposed, and to understand whether that's occurring. Importantly also, we need to understand whether antibodies protect, and certainly the data from animals and other coronaviruses suggest that is the case. We expect that is the case for this virus, but we're still working that one out.
Thank you. Now, Chris, I'd like to get to know you a little bit better. Secret talent. So for me, obviously, being a host of a radio station is my talent. What would be your secret talent if I was to ask you that question?
Oh, that's a hard one to put on the spot. My secret talent, well, certainly it's not entertaining or telling jokes and things like that, so I'm probably not up to being a full-time DJ. I enjoy to run, and I can play the piano. That's probably my two talents.
Oh, that's a good talent to have. Look, thank you so much, Chris. Again, your information's always been valuable to us. I'm now going to throw over to Q&A.
Call now on 6456 5629 or 0436 595 600 to ask a question.
Okay, now do we have questions? Yes, we do. From Beck. Thank you for joining us, Beck.
Thank
what
you.
What do you have for us this afternoon?
So I have some questions on COVID for Chris. First question is, what does the COVID-19 test actually look for?
So there's a couple of different COVID-19 tests, but the one that you see on the nightly news is people having a swab at the back of their throat and their nose. And what that is specifically looking for is the genes of the virus. So we can detect whether the gene of the virus is there, and that detects whether the virus is actually present at that time. I think that's really important to note because, importantly, if you contract COVID-19, it's going to take a couple of days before the gene can be present, and importantly, at the end of getting better, the gene will be gone, and in between times you may be able to detect the specific genes of the COVID virus at that stage. The other thing people talk about is a blood test, and that's actually looking for the immune system's response to the virus. It doesn't tell you whether you have it at that time.
Do we have any other questions? Yeah, we do. God, we're getting lots of calls for you, Chris.
So this probably leads on from your previous question, but can someone test negative on a COVID-19 test and then later test positive, all the while being infected?
Absolutely. I think this is really important because of some of the strategies we have around screening. If someone has been exposed and they have a test, it does not exclude that they're going to develop the infection. We know that the incubation period, the time from exposure to where symptoms normally occur, is normally of the order of 5 to 6 days. So in those first day or two, if we swabbed you, you would be negative. So that doesn't mean that you're not going to go on to develop the infection. So the thought that just everyone who arrives from interstate or overseas has a swab and can be excluded doesn't really help us, because they could be in that early phase before they're getting infection. So importantly, following up those people, making sure they know if they do develop symptoms, they do need to be tested, is really important.
There's one more question.
The recent outbreak in New Zealand has been linked to the possibility of the virus travelling into the country in refrigerated freight. Can the virus survive on cold surfaces for long periods of time?
It's a really interesting question, and one that I don't think we have a lot of information, particularly from the cold freight perspective. But I can tell you that the virus does survive on surfaces. It can survive on surfaces for hours, and it has been reported even up to days. So importantly, it's actually that transmission on some of the objects that are around us are really important, and so why some of the cleaning recommendations. Now, that may be hampered by temperature, very high or very low temperatures, but transmission may still occur in cool environments. So I think that you have to believe this report, but I would remind people that actually in those who have coronavirus or any other respiratory illness, making sure that we don't contaminate the environment around us, covering coughs and sneezes, making sure you're using hand hygiene and normal cleaning is a really important way of protecting ourselves.
Thank you. That's it. Thank you for all the callers. That's been fantastic and great questioning. So thank you again, Chris. It's been lovely having you on, and hope to have you back next time. So we're going over.
Welcome to Radio CAHS, presented by CAHS Chief Executive Dr Arish Anwar.
Welcome to Radio CAHS.
And we're back. So welcome again. It's Valerie over at Radio CAHS on this gorgeous Friday afternoon. So that was Chris, our lovely guest, but we now have Evelyn. So Evelyn is our new Health and Wellness Coordinator. Hi Evelyn, how are you?
Hi, thanks Valerie.
Lovely to have you on. But before I go on, I'm sure you'll find this interesting, but did you know that a key reason why friendships with magpies are possible is that we now know that magpies are able to recognise and remember individual human faces for many years. That is so true, because I've had one magpie I'm sure he's had his eye on me for a long time. But lucky I'm over in WA now. That was over east. So, I'll have to see if I connect with a magpie this spring. But more seriously, welcome. Wellbeing update. Now, you've been here how many weeks, Evelyn?
I think this is about my ninth week. Maybe?
Fantastic. Well done. So in your 9 weeks, just a quick summary of your initial thoughts and plans for the wellbeing space. Little wellbeing update.
Yeah, so I suppose I've really enjoyed the first 9 weeks. It's been great and busy. So just a couple of things that I've kind of started working on. So a lot of the staff would have seen that I sent out the wellbeing questionnaire. So this had lots of different questions, and I was trying to gauge areas that staff felt they needed a little bit of help in the wellness area. I also sent out an EOI for wellness advocates. So this was to have a bit of a network for wellness activities, and obviously to get a little bit of help promoting all of the initiatives I plan to run. Then I've started looking at things like critical incident debriefing, because that was definitely something that staff raised straight away when I came on board. And I've also, so I've looked at everything that's happening in the wellness space in CAHS. And one thing that I definitely wanted to start developing was a centralised wellbeing page. So that's something I've really started working on. This will be really beneficial to staff because they'll be able to go onto the page and see everything that's happening in CAHS and all of the resources that they can, use that we will have on that page.
Great work in your first short few weeks, and I know you've got some fantastic aspirations for the future at CAHS, so it's a very exciting space. In terms of your advocates, have you had some good uptake?
Yeah, so we actually have, I think it's 52 advocates across all of the different areas in CAHS. So definitely a great starting point to get all of the promotion out there.
Beautiful. Thank you for that.
No worries.
Now, there's an important or significant awareness day that I think we should highlight today, which is Are You OK Day?
Yes.
Now, Are You OK Day is on Thursday, the 10th of September. It's a national day of action when we remind Australians that every day, so that's every day, is the day to ask, are you OK? This year's theme, which I really liked, is a focus on what to say after you ask that question, are you OK? There are lots of resources on the Are You OK Day website, so we'll also be holding initiatives on the day as well. From what I understand, we'll have some mindfulness activities, an Are You OK Day talk by the Chief Executive, and I think I've got a chance to have a little say. I probably pushed myself in, but that's okay. You'll be hearing from me. Morning teas, Are You OK Day challenges. We will, though, have EAP on site. I think it's important to recognise that for our staff, days such as these can perhaps be confronting. So to have that support on site will be important. And aside from Are You OK Day, it's also Mental Health Month next month as well.
Yeah, in October.
Yeah. And also we also have Patient Safety Day on the 17th of September. So a few activities. Is there anything more you'd like to add to Are You OK Day? And really for us it's about raising that level of awareness, isn't it?
Yes, completely agree. Yeah. So we should always be asking, are you okay? But this is a day where we remind everyone to do that. So we will have an Are You OK Day ambassador on site as well. And if you have a look around, you should be able to see some of the activities. I have tried to incorporate activities that every area of CAHS can take part in as well.
Well done. Great initiative. So in moving forward, spring theme. I've got a bit of a spring theme going today. I don't think they knew I was doing that today, but I thought I'll just make it my own. And so it's spring, you tend to clean your house. So I thought it's a great time to also look at lifestyle in terms of spring cleaning. Now, an interesting fact is Evelyn happens to be a qualified nutritionist. And she has some handy little tips on how to bring back the lighter and more healthy eating habits that come with those long summer days. I got a good connection with potatoes over winter. So I'm looking forward to some tips on how I can maybe, disconnect a little with potatoes, maybe, because I don't know whether that could be described as a healthy eating habit. If I'm, it's all about portions, isn't it?
Well, yeah.
So how can you help us all with that, Evelyn?
Well, I suppose being Irish, potatoes are my favourite food.
Absolutely no connection, but I did know you're Irish, so I thought, that might help.
Well, I suppose there's a couple of things. So, first of all, I definitely recommend that people do weekly meal planning. So this gives the person the opportunity to be organised. It's a key to maintaining a healthy diet, and basically it leaves the decisions. So you basically decide what you're going to have that week, and then you write a list, and that basically means that you won't go off track. So you're not going to have any bad habits.
So writing that list is important, yes.
Yeah, so take 10 minutes each week to write down the meals and snacks required for the week ahead. Turn your meal plan into a shopping list by grouping similar foods, fruit and veg, and make sure you have a full stomach before heading to the shops to avoid hunger temptations.
Yes.
I do that all the time.
Oh, so guilty. I had to go, you're about to mention online shopping.
Yes,
Yes.
yeah. So I think sometimes that can be really beneficial from a time perspective. So just ordering everything online, and then you obviously won't order the foods that you're trying to stay away from. So then the next tip, I suppose, would be to be flexible with diets.
Oh, how flexible can we be?
So I suppose you should never really say a food is bad or good. You should never really be banning anything from your diet. You should always do your everyday foods and your sometimes foods. Then another recommendation would be to exercise regularly, because obviously good diet and exercise goes really well together. So something you can do in this area if you are a bit time poor is to do as much exercise as you can fit in. So things like walking from your car in the morning, using the stairs, these kind of things. It's recommended to have 150 minutes of exercise in the week, or else 75 minutes of vigorous activity. So you can try and fit it in that way. Do not starve yourself. So you should never really starve yourself, and that's when the carbohydrates come into play. When people tend to starve themselves, they crave things like carbohydrates. You can definitely have carbohydrates, just obviously keeping the portion size to the correct amount. And then the last recommendation, I suppose, would be to do not make excuses. So obviously a lot of people are very time poor, and it is easier to make excuses, but always trying to find times that you can put those healthy habits into place. So getting that 10 minutes to do your meal prep is key to making sure that you stick to those healthy habits. So yeah, I suppose they're the main tips that I would say to sticking to a healthy diet and healthy eating habits.
Fantastic tips, and look, and many that we do hear often. So, but it's nice to have that reminder, isn't it, to just reset ourselves if perhaps we have gone a little bit into the hibernation mode of winter.
Yes.
And having that comfort surrounding us. So, so a great time for us to think about how we can be healthier.
Yeah, definitely.
So some great tips for us. Now, Evelyn, as I mentioned, and I'm sure you'll agree, my secret talent, what is it? Oh, it's being a radio host. So what's your secret talent?
I don't know if I'd say I have talents, but I actually do sing. So sometimes I end up singing.
What sort of music? What do you sing?
When I was younger, I used to take part in a couple of competitions around charity events and things like that. So you could catch me singing anything.
Well, we might have to tap into that. We'll put that in our back pockets. Thank you. Look, thank you, Evelyn. That's been fantastic. So, any callers?
Call now on 6456 5629 or 0436 595 600 to ask a question.
Oh my goodness, the phone's just running hot here, Evelyn. You're a popular person this afternoon. I'm not saying Chris wasn't, but I'm just saying. So we have Beck.
Hello.
You have a question for us, Beck?
I have a question.
Evelyn.
So there's a new wellbeing strategy coming up that I'm sure you've been working very hard on. But can you give us a little bit of a preview as to what a new wellbeing strategy will look like for a CAHS staff member day to day? What kind of benefits are they going to be able to see?
So I suppose that was why I developed the questionnaire in the first instance. I actually just wanted to know exactly what those areas were that I wanted to improve upon. So the wellbeing strategy will be based on all of the research that we have received, so around the questionnaire, etc. So some things that I have looked at from health and wellness point of view would be things like mental health, physical health, financial health, and then your social health. So we've started looking at things, for instance, around the mental health area, debriefing. We're looking at the EAP and stuff like that in that area. In the physical side of things, I have started looking at initiatives such as Fitness Passport. In the financial area, we definitely want to improve education around financial planning, anything around that area. And then from the social perspective, we would like to, advertise more things in the social area, how we can get social groups going and things like that.
That's fantastic. It's a great work. And of course, I'm sure you're open to any other thoughts and suggestions from our staff. We need to hear from our staff. So
yes.
it's fantastic. Thank you to all of those staff that took the time to complete the survey. I know we often send out surveys, but we do look at the information. It's vital for us to ensure that what we set up can touch and reach out the needs for staff as much as we can. So that's fantastic. One more question.
So we know that sometimes it feels like all the emphasis in our health services on the green, shiny building per Children's Hospital. But of course, we have metro sites right across the metropolitan area. How will the strategy be rolled out across those sites? Have we got special ideas about how community mental neonatology are going to be incorporated into this health and wellbeing strategy? Yes,
100%. So I suppose I definitely want to be inclusive with all staff. So that means outside of PCH as well. So I've definitely tried to collaborate with the leaders across all the different departments. And that is also why we set up the advocate role and the questionnaire, because it gave the say to all of the different parts of CAHS. With the advocates, we have advocates in all the different areas. So they will help me drive the initiatives in community and anywhere else we have staff. So it's really, really important to have them on board. So they're going to help me with those types of initiatives.
Fantastic. So this is sad times because I need to wrap this up apparently. I could be here all afternoon. So thank you again, Evelyn, for your time. You've been fantastic and I'm sure we'll love to have you back to hear a little bit more about what you're doing in the future. It's lovely to have you.
No worries, thank you.
Thank you. Now, again, thanks to Chris and Evelyn, a fantastic guest this afternoon. Now, a podcast recording will be sent out to all staff later, including the question for the audience, but which I advised earlier today. Now, if you do listen to that in your sleep, you will recall, particularly Evelyn's 5 tips, just naturally, because, when you're asleep and you're listening to podcasts, do it while you're asleep. And then the name, remember the name, Valerie, for the annual Radio Host Awards. So, Radio CAHS broadcast is live every fortnight on Fridays. you will get Aresh back next week, you lucky lot. But tell us what your thoughts are, and you can do that by emailing CAHS, so that's CAHS, at comms, COMMS, at health.wa.gov.au. And remember, magpies have very long memories. So I think that's probably the fact that you'll take away this afternoon. But thank you for listening. Stay safe, and see you next time.
Welcome to Radio CAHS, presented by CAHS Chief Executive Dr Arish Anwar.